So thank you everybody today for joining us at the EPIC conference. My name is Bjorn Herrmann and I'm a scientist and assistant professor at the Rotman Research Institute at Baycrest and the University of Toronto. And I will be chairing this session today for the EPIC conference, and we will focus on cognitive health and dementia today. So the EPIC conference sessions, they take place on Zoom from 12 to 1 every day. So this week and also next week. And we encourage you to attend all of them. Check out the HWell EPIC conference webpage to download the program or look at all the details about the individual challenge areas and maybe watch a recording or so. So today's session will be recorded, and so it will also be made available for playback. And links to the playback will be posted on the EPIC conference webpage and the HWell YouTube channel. So you can have a look there as well, and also choose whether you want to enable captioning for Zoom in the Zoom toolbar. Okay, let's see. So what I wanted to mention before we get going, so that for all our participants today who are maybe new to HWell, I just want to quickly mention that HWell's vision is to provide leadership in technology and aging, and that HWell's mission is to develop a community of researchers, older adults, caregivers, partners, and future leaders that accelerate the delivery of technology-based solutions. And so the aim of HWell's work is to make a meaningful difference in the life of Canadians. And the HWell network comprises a large, lot of stakeholders, including people from academia, industry, government, not-for-profit institutions. And HWell really helps facilitate optimized aging and provides unique opportunities such as the HWell conference, HWell EPIC conference today. So I really like it. HWell brings together people from so many different areas, and it has been also for me so far really enriching hearing people's different experiences and backgrounds. Okay, so today's presentations will be such that I will begin today's session with a short presentation on cognitive health, so introducing the cognitive health and dementia challenge area. Then we will hear two research presentations, each with a 5-minute Q&A. And that will be followed by moving the dial presentation featuring a supported startup and a supported startup presentation, and we will also follow that with a general Q&A. So all attendees are encouraged to use the Q&A box to ask questions, leave comments on a question, or upvote questions that others have submitted. We also welcome you to use the chat. So this is an opportunity for all of you to contribute to discussions to our today's topic on cognitive health and dementia. So please use all those opportunities. So let me quickly introduce the cognitive health and challenge area. So you're probably familiar with some of those demographics, but I wanted to show them anyway. So this is a graphic from the Canadian Institute for Health from 2017, and it's about the population, the number of older people or people over 65 in Canadian society. And so the number has been projected to drastically increase over the next few years. And so for example, we are currently 41 million Canadians, and we're already about 9 million people over 65. And so that makes up about 19 to 20% of people in Canadian society are over 65, and the projections are that by 2070 it will be over 30%. And in addition, the current life expectancy, if you are 65, the life expectancy for you is still 20 years. So that's great. But when we look at the prevalence of diagnosed dementia, including Alzheimer's disease, and that's also from the Canadian, that's from Statistics Canada, the data I show you here. So you see on the y-axis, for example, you see age, and then the population percentage of people developing dementia in their lives on average. So you can see that the increase from 65, it's a relatively low percentage of people living with Alzheimer's disease and dementias. but it does drastically increase as we grow older. And for women, the chance of developing dementia is actually even a bit higher, and there's several reasons for that. But the numbers really drastically increase. So it affects individuals quite drastically. It affects their partners. It affects families. It has medical impacts. It has economic impacts. So it's a huge challenge in Canada, but foremost for the individual, obviously. So how can we address the cognitive health and dementia challenge? I just want to point out these four aspects that I think they're all important. So first of all, we want to focus on prevention. And so this is a plot from the graphic from the from Lancet reports that have been coming out over the last 7 years. Three of those Lancet reports that identify the potentially modifiable risk factors, and I want to quickly show them. So, for example, if we have reduced education in an early life, that could contribute to about 5% of dementia cases. Then in midlife, there's all sorts of risk factors, for example, hearing loss, the cholesterol, depression, traumatic brain injury, hypertension, obesity, and a few others, where one could potentially change those and reduce the risk for dementia. And then late in life, there's also vision loss that has been recently added, social isolation, and air pollution, although I'm not really sure why air pollution is only something that affects us late in life. But these are all potentially modifiable risk factors where lifestyle changes or early treatments can perhaps help reduce the risk for developing dementia and Alzheimer's. So that's a big challenge area where also a lot of work is happening. But then we still need to detect early dementia, and particularly, especially really early if we can, because the modifiable risk factors account only for about 45% or so of dementia cases, and realistically, the number is likely a bit lower. Oops, I'm on the wrong slide. But so there's a substantial amount of non-modifiable risk factors that are genetic contributions. And so we certainly need to get better at detecting dementia cases and specifically also distinguishing between specific subtypes, for example, amnestic and non-amnestic mild cognitive impairment and other subtypes as well. But then there's a big challenge area also on treatment, and I think this is where a lot of hope lies currently, whether medicine can finally come through and help with treatments. Some are in clinical testing. There have been just recently like a medication approved, although it's not as big of a game changer as was hoped originally. But there's also other aspects related to treatment, so cognitive training and lifestyle intervention that may be beneficial. But then certainly we will have dementia cases in our society. So new approaches to care is also really a big area that is important, focusing on person-centered approaches, including support to live longer at home and having integrated healthcare approaches. And I think we will hear a little bit in those spaces today in our presentations. So I just want to emphasize these upcoming presentations, and I will give over the slides now to Sina, Shafiyan, and also Gale, Griffith. So maybe I will stop sharing my screen, and you can start sharing your screen. And I will. Oops, I gotta close this, and I will introduce our speakers. All right. Let me find my. Okay. I need to like switch it around here. I don't know, Sina, do you want to share your screen already?
Yes, I did, I think. Can you see the screen?
Yes, I can see it. So, okay, let me quickly introduce the two of you. So, I'm very excited about this first presentation here. So it's by Gale Griffith, who is an active, independent 86-year-old. She is a retired social worker, teacher, and palliative care caregiver, who is now a proud grandmother of 4. She drives, writes, golfs, and is honored to be participating in clinical trials as a healthy and elderly benchmark. And that's also, I really appreciate it being a researcher that there's contributions and people who are dedicated to helping us do our research. And then there's our second speaker is Sina Safia, who is a PhD student in rehabilitation sciences at the University of Ottawa and a research assistant at the Bruyère Health Research Institute. At the university, he studies how aging and Alzheimer's affect emotion experiences using AI. And at Bruyère, he focuses on early signs of cognitive decline through speech and eye tracking data. And he volunteers at the Dementia Society in Ottawa to help raise awareness. And so his goal is to bridge research and real-world care to better support older people living with cognitive decline. So please take it away.
Hey, hello everyone, and thank you for the kind introduction, and thanks to AgeWell for the opportunity to share our work today. We are excited to present how we are using tools to track eye movements and speech during simple tasks to help us spot early signs of cognitive decline. Just to add a little bit about myself, I've been involved in health-related research for the past 8 years, and I joined the Bruyère Health Research team for this project in 2023. Today, I'll explain the procedures, how we collect speech and eye tracking data during tasks like picture description, and how we analyze that information. Now, I'll pass the floor to Gale.
Hello, everyone. I'm here as an elderly person to share with you later my thoughts and my feelings and my experiences of what it was like to take part in this research project.
Thank you. Okay, so the background for this project comes from growing evidence that subtle changes in how we move our eyes or speak can be early indicators of cognitive decline. Our project looks at both together to see if they can help us detect early changes in the cognition. For that reason, we have three objectives. So the first is to combine the two biomarkers, speech and eye, for improved sensitivity and robustness. The next is to use affordable technology, for example, a webcam instead of a research-grade eye tracker. And the last is to create a low-stress, repeatable environment where we can remotely assess the cognitive decline. This project is an 18-month observational cohort study. We have recruited 30 participants so far, 15 healthy controls and 15 with cognitive impairment. Each participant first completes baseline cognitive assessments, including the FAQ, the MoCA, and the UDS-3 neurocognitive battery. And then on the photo, as you can see, on the right side shows our computerized dual assessment setup. The Tobii eye tracker placed just below the monitor and the webcam on the top capture eye movements such as fixations and saccades. Additionally, a clip-on microphone pinned to the participant's clothing record their voice. Participants complete a series of tasks like describing the cookie theft picture, reading a story aloud, and recalling it later. This is an example from our visual delayed recall task. In this one, we ask participants to simply enjoy looking at a series of images shown one at a time. Here is an example of one of our 7 images. Using eye tracking, we generate heat maps that shows us where each participant. The yellow area here marks our region of interest, the umbrella, which we manipulate later in the task, removing it after 1 minute. On this slide, you can see heat maps from two participants. On the right is a healthy older adult, and on the left is a participant with mild cognitive impairment. Even at this early stage, you can already notice differences in their viewing patterns, particularly in how much attention is given to the umbrella. In the task, when we remove the umbrella, our healthy participants tend to notice and shift their gaze to it, but our participant with MCI seems not to notice this change, which suggests potential difficulties in delayed memory recall. This type of visual data helps us understand how attention and visual exploration may change with cognitive decline. The cookie theft is a classic picture used in cognitive testing where participants describe what they see. Here you will see a real example from our study where during the task, the participant was viewing only the cookie theft. What you are about to see is a visualization that our team developed and programmed, combining their eye movements and speech into a single synchronized view. The red dot shows where the participant is looking, while the text below shows what they are saying in real time. Green highlights show when they fixate on a key part of the image, and pink highlights show when they talk about it. These combined views help us understand how people with and without cognitive decline explore and describe the scene, and how those patterns differ by analyzing their speech and eye movements. This time plot also combines eye tracking and speech data from previous participants describing the cookie theft. The vertical colored lines show what the participant looked at, and the black horizontal line shows when they verbalized each object out of 11 predefined items. This allows us to realize what they saw, when they saw it, and when they mentioned it, or if they missed it entirely. For example, we can detect delays between visual attention and verbal identification, or objects that were never mentioned despite being fixated on. And I'll pass the floor over to Gale.
Hello again, everyone. I oh so wish that this amazing diagnostic tool could have been available 45 years ago, as I witnessed the decline of my own mom succumbing to Alzheimer's disease. If only she could have experienced the benefit of the early detection right at the onset of her cognitive impairment. What a difference it would have made in her life, protecting and preserving her autonomy and her dignity. We are so lucky today to have our modern technology. As well as the obvious human benefit, there's another facet of this project that must be acclaimed and heralded. The discovery of being able to assess remotely with a webcam versus very expensive eye tracking equipment is a huge bonus in cost saving. Kudos, Sina, to you, and a hefty applause to you and fellow researchers for all your very dedicated, hard work. Thank you. And my experience with the system, I'm so very honored to have been part of this clinical trial and all the assessments that have created this amazing tool of the future. Even though the system was still in its testing stage, it was not difficult to use the basic technology at all. nor was it difficult to follow the instructions. Something that I found really important, being tested remotely as opposed to being at a hospital or in a doctor's office is definitely less stressful, certainly more comfortable, and it did not feel at all intimidating nor judgmental as it might have otherwise. And I have to say this, having personally witnessed the interest and all the subsequent research development progress that is being created to help the elderly age well, I am now aging with much more confidence. And who's to say that some of these wonderful aspiring researchers that have worked on this project may someday benefit from their very own personal ingenious?
Thank you, Gail. So we want to express our gratitude to our partners, Agewell, Carleton University, and National Research Council. We also want to thank the NRC's Aging in Place Challenge program for their support and to our participants whose time and contributions made this work possible. We also want to thank our primary investigator, Dr. Frank K. Knofel, for his continued support and the entire team for their collaboration throughout this project.
Thank you so much, both of you. That was really cool. We have one question in the chat, maybe I read it. Does this testing needs a family doctor referral?
So this testing is at its pilot stage. We are only developing the entire system. Our hope is that one day you will be at the doctor's office and you will be able to do this test. And yeah, so at the moment, uh, it's only at its pilot stage, and we'll see if we could validate the findings in the next phase, and then for the last phase, hopefully the implementation of the whole system in the care system we have.
Oh, we have another question in the chat. A person writing that they are from Grey Bruce and ask whether this is available also in a small community.
So, great question. As I've mentioned, it's not available yet. We are developing the system and we are still working on it, and analyzing is not finished yet. That's a very good question because one of the hope we have is to make this tool accessible in areas where being assessed for cognitive decline is more challenging for those individuals living in those areas than others. So making the tool accessible is our aim and our hope. And yeah, so I hope that we'll get to that point.
Cool. There are two questions. So I think we have time maybe for one quick one, and then I would say I will keep track of those that we can have some time later. There's one person asking, are you engaging with solutions providers to delay dementia?
So this is to help. So the system is to help us detect early signs of cognitive decline. And we have clinicians on the team, such as Dr. Knofel and Dr. Neil Thomas, who are overseeing the clinical aspect of dementia and detecting the early signs based on medical evidence. But in terms of, if I got the question right, in terms of uh, doing that to delay the dementia onset, the system itself, it can help because if we detect uh, Alzheimer's and cognitive decline early, it will have an impact on everything, on care, on caregiver burden, on early admission and
Okay. I'm really interested in Gale's perspective on what the time commitment to the project was and how to get recruited. Maybe you can, if you can quickly, like a few sentences, say something to it, or we can come back later at the end. How did you get involved there? I do have a look. I look a little bit at the time. We are kind of
Okay, during COVID, I was watching a seminar that was put on, and it was Frank Knopfel, and somebody, and the question period at the end, somebody asked why it's taking so long to solve, to be able to solve and put a stop to cognitive disease, and his answer was that it's difficult to find 82-year-old healthy benchmark. So the next day I phoned and said, I'll be 82 in a couple of weeks. And so that's how I got involved in the clinical trials.
awesome. Maybe we have a little bit more time at the end to hear more of your experience and also from our other presenters today. I find this really interesting to hear. Also, I wrote down a few things already that you said that I found really insightful about your experience. All right, just to kind of looking a little bit at time. Thank you so much. Joy, will you be able to share your screen while I introduce the two of you? So Joy Lay is a master student in biomedical engineering at the University of Toronto and the Institute for Biomedical Engineering. Her research focuses on machine learning models for anomaly detection in assistive technology and aims really to support older people with living with dementia and their caregivers. And she's working on digital reminder systems, early warning systems, and has broader interest in machine learning in rural healthcare settings and making sure that AI is used in ethical ways. And then we also have David Black here today. And he was a caregiver for his mother for 17 years after she was diagnosed with vascular dementia. He is a strong advocate for aging in place and has considerable experience with regards to setting up and maintaining and adapting this form of care. So he has joined in 21 the Maritime SPORE Support Unit, where he completed his training as a patient partner. In 23, he was a member of the University of New Brunswick and the Center for Research in Integrated Cares, navigating dementia in New Brunswick. So he participated in this research there and evaluated navigation service for persons with dementia and their caregivers. He is currently a member of the CCNA, engaging the subsection engaging of people with lived experience of dementia, and this which is an advisory group, and you're working on several dementia health research studies. Okay, take it away.
Thank you for the introduction. Hello, everyone. My name is Joy. As Bjorn said, I'm a master's student at the University of Toronto. I'm working in the Intelligent Assistive Technology and Systems Lab. Today, David and I will be sharing a bit about my thesis project, which is being supervised by Dr. Alex Michailidis. This work focuses on a co-designed digital reminder system aiming to support both people living with dementia and their caregivers. As many of you are probably aware, dementia can make it quite difficult to manage everyday tasks. So things like memory loss and confusion can get in the way of routines like taking medication, going to appointments, or even meal prepping. As these challenges start to build up, people can often rely more and more on caregivers like family and friends who end up taking on a lot, both emotionally and physically. So to help manage this, some people might use things like sticky notes or reminder apps. And while those can be quite helpful, they often depend on the caregiver being there in person, and they don't always let the caregivers know if something goes wrong. And this can make it hard to step in quickly or provide consistent support. So caregivers may still feel like they're always on alert even when they're using these tools. And that's the primary gap that we're aiming to address with our system. We've been working on this digital reminder system that has three main features. The first is that it's location-based, so it delivers reminders exactly where they're needed around the home. And second, we're exploring the integration of smart monitoring, so caregivers can be alerted when something seems off or unexpected. And lastly, and arguably most importantly, our system is co-designed. It's being developed with continuous input from both caregivers and people living with dementia. So starting with the location-based feature, we use tablets that are placed throughout the home, like places at the front door or in the kitchen or near the bed. So similar to how people would put sticky notes around the house, caregivers can send reminders from their own device, choosing both what the reminder says and where it shows up. So a tablet in the kitchen might say to turn off the stove, and one by the door could say to grab the keys. We're also exploring how we can use data from reminder systems to help support unobtrusive monitoring. So we want to help caregivers notice things that might be important, like reminders being missed, any unusual responses, or even gradual drops in interaction with the devices. And to do this, we're using two machine learning approaches. The first are autoencoders, which help us spot interactions that are outside of someone's normal routine. But because everyone's routine is at least a bit different, we've added transfer learning so the system can adapt to each person's specific habits and routines. And finally, the system has been co-designed from the beginning. We're working closely with two members of the engagement of people with lived experience of dementia throughout the development process. And in a moment, David will share his perspective on being part of that team. And we're also preparing to run a second round of interviews and usability testing with people living with dementia and their caregivers. And that part is still ongoing, so please stay tuned if you're interested in getting involved once we start recruitment. And with that, I'll pass it over to David, who will talk a bit more about his experience as a co-designer on the project.
Thanks, Joy. In 2005, my dad was rushed to hospital where he immediately went into surgery. Post-surgery, he would undergo treatment for stage 4 colon cancer to his liver and kidneys, as well as being left with managing a permanent ostomy. 2 weeks after Dad's surgery, my mom was rushed to hospital after suffering a major stroke. Mom would eventually be diagnosed with vascular dementia and would require the use of a rollator for the rest of her life. This was the beginning of my 17-year journey as primary caregiver for both my parents, who would eventually be discharged from hospital to my care at home. My 72-year-old father at the time would go on to beat his stage 4 colon cancer into remission and lived a full life for another 13 years before passing away in 2018. For another 5 years after that, Mom would continue to battle her dementia with the same courage as my dad had with his cancer. As I look back on those times, I realized how much I could have used the reminder system to help me keep them safe, as well as ease the worry I felt with their care. As many of you know, pets can and do play a vital role in the health and welfare of their owners. However, looking after a pet can be a challenge for someone living with an illness. The reminder system would have allowed me to remind Mom to feed Dylan, as well as put him outside in our fenced-in backyard ahead of someone visiting the house. I could have also sent reminders to Mom to make sure the furnace technician remembered to reset the thermostat correctly before he left. I could also remind Mom to make sure the door was locked after someone left the house, and to let her know that I'd be there shortly to pick her up for a doctor's appointment. These are just a few examples of how this technology could have helped me as a caregiver. And slide 2, please. In April 2024, I joined the Canadian Consortium on Neurodegeneration and Aging, EPLED Advisory Group, as a member from Moncton, New Brunswick. EPLED's mandate is to be meaningfully and actively involved in the research process, including governance, priority setting, conducting research, and knowledge translation. This project aligns perfectly with EPLED's goals of representing the lived experience of people with dementia and their caregivers by identifying technological solutions to address daily challenges. Together, our collective experiences reflect the significant challenges faced by all dementia caregivers. The co-design approach championed by Joy Lai, AI Research and Development Lead for the Reminder System, has enabled us to meaningfully influence both the design and the ultimate benefits of this technology. Along with my EPLED colleague, Kelly Beaton, we're continuing our work as team members to further develop and advocate for this technology in the hope that it will be commercialized so that its benefits can be made widely accessible. As a person with lived experience of dementia, I'm not asking the research community to solve problems for us. However, I am instead respectfully asking them to please solve these problems with us. I'd like to thank Joy and the Reminder System team for providing us with an outstanding opportunity to do this work on a truly collaborative and respectful basis. In conclusion, I'd like to thank my late parents, Ralph and Irene Black, for providing me with a truly amazing example of what it means to face traumatic and intense life-threatening illnesses over a very long period of time with grace and determination. This will always be my memory of my parents over those 17 years, and I'll continue to be inspired by that for the rest of my life. Thanks everyone for your time, for listening to me today.
Okay. A little bit of a delay. That was great. Thank you so much. It was very, very interesting research, very interesting perspective. So we have one question here in the question answer. Is there a place that people who are interested in this technology can follow along with this research and develop development of this reminder system? Maybe that's a question for Joy.
Yeah, so our end goal is to commercialize. We're not quite there yet, but in the meantime, I'm happy to drop my email in the chat maybe, and if anyone has questions, they can follow up with me directly.
And then maybe a question I have for David. How have you thought about like privacy concerns? How has that been addressed? Monitoring older adults in their home, especially like gaining consent from people with, living with dementia. What's your experience like there?
Well, I think on the onboarding part of it with regards to our trial, we are making people aware of that and of how we handle the data that we receive, and that it is, we don't have it forever. It is eventually deleted. I think going forward in the commercial space, I mean, that's an area where we haven't even begun to think about that. But I think it's important that we apply these considerations both to the person with dementia and their caregiver, because the person with dementia is going to be responding using their cell phone with reminders and then follow-up questions to see whether or not the person actually did the task when they clicked OK. So there's privacy issues for both caregiver and the person with dementia. but we're developing that as we go. It is very important.
Yeah. Well, thank you. Let me see whether there's some other questions. There's certainly thank yous in the chat about David about sharing your experience. I think it is really inspiring. Looking a little bit at the time, we will have some time at the very end for more questions. But maybe for now, I thank the two of you, and then we move on to our next question, and then bring you back later for the Q&A at the end. Okay. So now we're moving on to our third presentation related to moving the dial. Presenter Mani Courage of Inclusit Pro. So Inclusia is focused on advancing accessible housing outcomes through education, technology, and collaboration. And as a founder and CEO, Mani is a creator of Inclusit Pro, a revolutionary health and home assessment platform for healthcare professionals. The platform is also a free aging and home safety planning tool for the public, and with research being conducted at the University of Manitoba and the Center for Technology Adoption for Aging in the North. So these evidence-based solutions are designed to improve outcomes for older adults and people living with disability in Canada. And so Inclusia's technology innovations won HWEL's 24 National Impact Challenge. So that's amazing. So please take it away. Very excited to hear that.
Thanks, Bjorn. I'll just get this set up for us here. Okay, can you see my screen okay?
Yes.
Okay, thank you. So as mentioned in the bio, we've got two products through Inclusia, and I wanted to clarify that this first one is Inclusit Pro. This is the one we're focused on today. It's the revolutionary health and home assessment platform for healthcare professionals. The one that Bjorn mentioned that is free to the public is a different version. That is called Inclusit Home. Both of these tools we are scheduling and planning to come to market in October of this year. So as mentioned, Inclusia's innovations are really aimed at optimizing outcomes for people with disabilities and older adults in Canada. And I'm really focused on supporting Canadians to live safely in their communities as they age for as long as they wish or are able. And Bjorn had talked about some of the statistics about dementia, but I want to talk a little bit more about some of the impact of those statistics and really what we're missing. We're missing the data analytics capturing functional status of older adults before these kinds of declines are detected. And what are people's healthcare and housing needs? Late dementia diagnoses, as we know, often come after an injury or an incident occurs for an individual. We know there's long wait times for support services and interventions. And we know caregivers are burnt out and overwhelmed by the care they're needing to provide their loved ones. There's a lack of community service navigation support in terms of where people go to look for products and services to support themselves or someone they love. We also know there's stats on the fall-related hospitalizations that could be prevented. We know there's premature admission to long-term care facilities. There's reduced mental status and mental health status and dignity for individuals who are struggling but have not yet been identified or diagnosed with dementia. And most of our homes are not set up for cognitive decline and supporting any kind of cognitive limitations that folks have. So introducing Inclusit Pro, and as Bjorn mentioned, we're so proud to have won the National Impact Challenge from AgeWell last year in October, and we're still benefiting from that ride. So thank you very much for that. And really, you know, it's really important to me. I'm an occupational therapist by background, by the way. I'm in Winnipeg. I was born and raised here. I own an occupational therapy clinic here. So for 20 years, I've worked in industry and identifying some of the gaps and frustrations our clients and family members had been dealing with. So we've partnered with the University of Manitoba and CTAN on the research on this project, because it being evidence-based is absolutely paramount for me in bringing this to market. So it's a really comprehensive digital platform tool that is designed by occupational therapists for occupational therapists. And if there's occupational therapists here, I'm going to talk a little bit about sort of what it does. But for anybody else, these are the components that it will allow an occupational therapist to assess. And it doesn't have to be after an incident or an injury. This is trying to move the dial back to prevention. And as Bjorn mentioned, sort of those 4 domains: prevention, detection, treatment, and care. This platform addresses all of those things. Today, I'm going to be focusing more on that cognitive assessment and how this tool can really benefit both the healthcare professionals and the clients or patients they're working with in a variety of settings. So obviously the privacy settings is one of the questions that's come up earlier in this call, and it absolutely is meeting government regulations and our regulatory body in occupational therapy, the professional regulations. We're using advanced algorithms for accurate data collection and instant reporting. And right now there is no AI involved in it. We really want to test it with clinicians using clinical reasoning, doing things in a digital way, getting used to changing our methods from manual to digital. That's a massive behavioral transformation in our profession. So once people are trusting and using the product, then we of course will be layering in AI to ease the clinical assistance, let's say. So there's also a comprehensive database of products, services, and home adaptation solutions. This is something in our profession that's never been available to us, and we're often searching on the internet for some of the solutions that we're presenting to our clients and patients. It produces tailored care plans and home modification plans. It's got product, vendor, and support service directories. This is something we're currently building right now. And as you all can imagine, as soon as we get this live, it's probably going to be archaic. So we're looking at a robust system of updating these directories to stay current. And I'm sure there's many people on this call that would say, I wish I had access to look for support services and product vendors in my area. So it is geolocated to the client's location. And then referral recommendations. So if you're working in a hospital, or if the healthcare professional is working in the community, you can make referrals to multidisciplinary team members. Then we've got this data analytics, and this is something that was really lacking in our industry, is what is the impact of occupational therapy intervention? What is the impact of being assessed, and what is the change for the client? How do we measure that change? So again, a lot of research is going into measurements and outcomes here, which we just do not have, and everybody in Canada is hungry to get. And of course, in delivering this, I really want to make sure the tool has offline capabilities. In Manitoba, we have a huge rural and remote community population that this tool needs to work for. So as you can imagine, there's a lot of challenges. And that's why working with CTAN up in northern British Columbia has been really exciting to get stakeholder feedback on the product for folks who would be using it up there. So client outcomes, obviously, this is where my passion comes from. This is what I'm trying to do. Improving the health and wellness of individuals with this early detection, early assessment, and of course, expediting home safety and accessibility, preventing those falls, increasing participation in daily activities through the education that the OT would be providing in the home as they're doing the assessment with the caregiver and the client. Identifying all those safety and hazard risks and getting really quick and low-hanging fruit solutions and with no-cost solutions in place quickly, like decluttering, changing where we locate things in our home that people need to access. And really, I'm looking at preventing premature admission to hospital and early intervention caregiving support and home adaptations. We've got a very long list of other impacts, but this is what we're going for, and this is what I really do believe we'll be able to reach before we go to market. So if there's occupational therapists on the call, I definitely want you to know about this. Is so robust. We have nothing like it in our profession. I've included 24 assessment components for physical, cognitive, mental health, culture, spirituality domains. We've got 18 performance areas for assessing daily activities. We've got unlimited interior and exterior spaces of the environment, of the home environment. You're able to upload photos of the clients. We're able to add your own screening tools as you go. And so you can hear that it's very robust. I'm going to take you through a little tour of what it does so you can get an idea. So I've made it so flexible and dynamic so that as we're changing from manual assessment methods to digital assessment methods, we're allowing for a hybrid approach so that healthcare professionals are still able to do their paper screening. So if you're doing a MOCA, I know as Sina had mentioned it earlier, if the FAQ, the MOCA, the US, or the UDS3, whatever you're using, you can still use those screening tools. And you take a picture of it with the tablet, it uploads it into the platform, and then attaches it as an appendix to the instant report that comes out of this platform. And by entering your screening results right here, or your test results, we're able to collect that data that will help inform policy change and looking at federal programming that could increase the wellness and health of our older adults. The other thing I created into this was a therapist sticky note. So things that you may not want to say out loud during an assessment, especially a cognitive assessment. It's a note or a reminder for the therapist. It might be to if you're interviewing a client who has cognitive decline or limitations, and they may not be representing accurately what they're doing with medication, you put a note in here to talk or phone with the caregiver later in a dignified way. There's also an informal cognitive assessment built into this if you're not using a formal cognitive screen. And one of the really great education components to this is it really does teach young or new occupational therapists as they're coming into their practice to help guide that clinical prompting. So if somebody is having trouble getting in and out of the bath, you choose their level of independence here, and up pops up, well, what is the reason they're having difficulty or they require supervision? And if you choose cognition, then it prompts you again, well, what are the areas of cognition that are interfering here? And it goes on to prompt sort of those questions that a novice or early OT or even an experienced OT may forget to ask. So all of a sudden, this is really a clinician's toolbox to ensuring we get accurate and informed data during our assessments. I really love the way that it can input photos very easily into the platform. Remember that we are definitely getting 3 levels of consent. Consent to participate, consent for use of information, and consent to use photos for the reporting. So you can upload photos, you can annotate the photos. It's a really great communication tool, and we'll talk about how that reflects in the reporting. You can also make healthcare referrals, right? So if you're working with a multidisciplinary team and you're suspecting a geri rehab referral is needed, or the caregiver is really looking for respite services, or now they're interested in maybe some public home care or private home care, we can indicate those referrals here and they will go into the report as well. I mentioned the directory listings. This has been something I wish I had all my career, and we're building it. And I'm not disillusioned by the amount of work it will take to keep it up to date. But we've got it into many categories. And it's important to me that this tool be culturally safer and have Indigenous representation. So obviously we know there is not a provider list or a directory listing for Indigenous healing services. But what we've done is have a placeholder here to allow for people to connect locally. I see Bjorn's popped up and I know my time is limited. I will quickly just show you some screenshots here and I'll end this very soon. So we can do a full environment assessment. There's a lot of prompting about the room-specific safety concerns and accessibility barriers. Then this is the magic, guys. This is where it shows all the database of recommendations that we may be prescribing, and it's all at our fingertips in one place. So that we can also educate clients and caregivers what these kinds of things look like. And here's some adaptive tools for people who are experiencing cognitive decline. And I'm almost done here. Just want to show you a sample of this is what we would be looking at from a concept level of home modifications if there's some changes that need to be made. and it even has a floor planner to be able to communicate with renovators and construction specialists. A report pops out with all that information I showed you, and see how it attaches the MOCA right at the end of the report. So you have everything in one place, and that is a super quick snapshot, but I hope it engages you enough to ask some questions about it. Thank you so much.
Thank you, Mani. We have one question here in the question answer. Are these assessments covered by OHIP or are they private?
Thank you. So occupational therapy assessments, there's two ways to access. One would be through the public healthcare system. We've got the Canadian Occupational Therapy Association, and they have a directory of private occupational therapists. So for some people who have extended health benefits, that may cover the private assessments. But I am hoping that this becomes adopted in our hospitals, in our personal care homes, in communities, so both in public and private healthcare.
And then another quick question on this is whether it's a timeline when this will be available. There seems to be some occupational therapists who are really excited.
Yes, there. I see Karen Carney in the post there. Nice to see you. And when is it coming to market? Was that the question?
When it will be available? Yeah, what's the timeline?
October 1st is the plan. I've got a lot of work to do with security testing and some usability testing over the summer, but we're very excited and we're pushing hard for October 1st.
Awesome. Yeah, let's maybe also bring the our other presenters back in and open the discussion a little bit more. If there's a few questions, we only have a few more minutes left. But maybe basically, Mani, I was also wondering whether you can quickly comment on how Inclusia advocates for aging in place home modifications. That also relates to David's experience and Joy's work as well.
Sure. I'm on several committees. Accelerating Accessibility Coalition of Canada. We are working very hard to look at the different standards and practices in home modifications. I advocate very strongly for a federal program in home modifications because right now our funding is just provincially and it's scattered. There is very little funding for essential home modifications and preventative home modifications. So I strongly am advocating for a federal program like the UK. Australia has one too. Canada's next.
Awesome. David.
Yeah, just a quick question for Marnie. On your last slide there where you talked about you had a directory of providers for home adaptations and maybe service providers coming to the home.
Mm-hmm.
How do you manage that if a caregiver or family has found someone that they're comfortable with that's not on your list?
Yeah, so my list is a resource only. I am not saying, hey, Mr. Jones, use this contractor, but we are partnered with Canadian Home Builders of Canada, the association, and there's an adaptive home program. So the people who are skilled and have taken the adaptive home course are the only ones you're going to see on my directory. So those are the ones I'm going to see on your directory, but client choice is client choice. We want you to use whoever you want. If there's an experienced OT helping you out, they will tell you that make sure that they have, that they're taking out permits, make sure, have they had experience on accessible design, and they can help guide you to prompt in making your informed choices.
Yeah, excellent. Yeah.
Maybe I can also ask a little bit more broadly to everyone. And so what are your hopes for the future of age tech and that kind of space, but also in your specific field? Maybe you have some views where you would like the field to go.
I think privacy is on everybody's mind, right? And so I think we have the responsibility in technology for aging to ensure that we are respecting and informing anybody's privacy and how it's being used and being very clear about how the information is used. And that has to be at the foundation of any technology solution in this area. And sometimes we don't know what we don't know until there's a problem. And so I think we have to work together better and talk to each other about our what did you do for this? Or how did you, de-risk this? And work with our information data scientists to figure out how can we better secure that information and yet still use it in an aggregated way to help inform policy.
Yeah, we face it in a lot of places. I'm looking a little bit at the time. Maybe Alison will soon say we should wrap up. But I just wanted to say it's really amazing. I really liked those different experiences, and I really like that involving people from the community in the research. And I really also wanted to thank people to actually do that and be interested in science, particularly in times where science and research is sometimes challenged. So it's really important if we want to make progress in society to bring all perspectives in, and I think this is a good representation today. So thank you all. Thank you all again, and I hope it was informative for for our participants. And the reminder, there will be more sessions next week, so please attend those as well. Thank you again. Thank you so much.